You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with gum disease. No more traditional surgery with this new LANAP protocol using a laser to kill this bacterial infection in the mouth. We've had her on the program before. She said the symptoms are bleeding gums, bad breath, loose teeth. If you have any of those things, you have to hear what Dr. Dassani has to say. Dr. Dassani, welcome to the program.
Thank you. It's good to be back.
Now, I interviewed you quite a few years ago, or not quite a few, but about 3 or 4 years ago about this topic. So, gum disease. What are the symptoms, first of all?
Bleeding gums, that's the most common symptoms I see patients come in with. Loose gums, they feel like their gums don't hug the teeth the way they should. They're not as tight around the teeth. Just bad breath. They have, most commonly, patients say they have to have a mint in their mouth all the time because they're so conscious about their breath. And loose teeth. My teeth are shifting. They didn't used to be in this position. It's just amazing.
Okay, so gum disease, right? Or periodontal disease, same thing?
Yes.
Okay, so there's 2 ways to treat it. One with surgical and one with the laser. So tell me a little bit about how it's normally treated and how you do it.
So, we have a lot of dentists around where we are, a lot of periodontists that are your gum specialists, and the traditional way of treating it is by cutting. What I call treating by amputation, because you're cutting away the gums that are causing the deeper pockets, the diseased part of the gum. It's not a fun thing to have done because you have your gums cut away. There's sutures, a lot of stitches around there, a lot of downtime I find, and it's quite uncomfortable.
So the traditional surgery, okay, so under the gum line is where this
bacteria. This is a bacterial infection.
So with the scalpel, they cut the gums, open up the gums, and then just clean deep.
That's right. They scrape away at the bone to get rid of the bacteria, and then put everything back together.
Like sew it back up.
And sew it back up with sutures or stitches, yes.
So and that's how it's done, like right now, like hundreds of these procedures?
Yes, right
in
as
your
we're
neighborhood?
talking. Yes,
really?
All around the country, yes.
But you say there's a better way. I
There
don't want to put words in
is.
your mouth, but there's a better way.
There is, and I'm so excited that we offer this at the practice, and it's as simple as using a laser. This laser is specific to where it targets the bacteria that cause this disease. The bacteria that are associated with periodontal disease or gum disease are colored. They're orange, brown, black, and the laser seeks out those bacteria. And I tell my patients, this is almost like Star Wars here, right? We're gonna use the laser, go below the gums where those bacteria are at the level of the bone, and the laser energy is going to implode those bacteria. It's going to kill those bacteria at the source. And this is a bacterial infection.
So you go around the mouth.
Yes,
with
around
the laser.
every tooth, yes. There is no cutting. There's not one time that I've had to take a stitch or take a scalpel to the mouth to get access with the laser. The laser does all the work for me. It seeks out the disease. How amazing is that?
Now, the periodontists are the gum specialist. Knowing you were going to come here, I've talked to some periodontists, and I guess it seems like more than half of the periodontists now are getting the laser.
They are getting on board, yes, because they see that it does work. It does help. It does what it's supposed to do. The laser is now FDA approved for this procedure. There's the proof.
So the gums get healthier. Like the bleeding, how soon can the bleeding gums go away? And the bad breath?
I've seen it almost right away. I have. There is no downtime. First, for me, that is a huge thing, that my patients don't have downtime. We're taking away, and I know I keep coming back to this.
There might be some discomfort, to be fair. Is that correct?
It's usually Tylenol and Motrin that addresses it. We don't need any of the heavy-duty stuff. It's no more than coming in and having a procedure done. Yes, she did do something in my mouth, but not.
They're numbed up. They're numbed up.
They are, yes, yes, but not the kind of downtime that I've seen where they've had to cut the gums open.
All right. Well, help me understand this. I have a first cousin. He was scheduled to lose like 4 teeth. He sees a periodontist with a laser here in San Diego, and none of those teeth were extracted. How does it prevent tooth loss or keep you from pulling teeth? Help me understand that part.
Yeah, this is a story that's very common at my practice too. We see people that come in with, I gotta get all my teeth pulled. Can you help make me dentures? Or I really don't want to lose my teeth. How can you help me? And like I said, using the laser at the level below the gum line at the level of the bone where those bacteria are sitting, they're eating away at the bone. That's what they're doing. That's what's causing the teeth to get loose. That's what's causing the little ulcerations in your gums. That's causing the bleeding. And when we go in and we get rid, it's a bacterial infection and you treat it like that, you get rid of the bacteria, that's what does it. And once you've created that clean area for your body to be able to regenerate, your body goes, I can breathe, there's no bacteria here, I can actually start to heal myself. You actually see the gums getting tighter, nice pink healthy gums. In cases we see some bone growth as well, teeth become tighter, there's just more collagen being laid around. And what have we just done? We've saved your teeth.
So when you have this bacterial infection under the gum line, the gums pull away from the tooth, and that's how the tooth gets loose. And so when you kill it with the laser, the gums grab onto the tooth again? Is that kind of how it works?
That's right, because once we've used the laser to clean away at the bacteria, the diseased tissue, we also go in and we clean the teeth under the gums there. We're basically creating a clean environment for your gums to be able to reattach. And that's what's going to make everything nice and firm and stable and get your teeth to be more solid in your mouth.
How does the breath get better? That's the part. I mean, what is that?
When
so if somebody has really bad breath, what's the connection?
When those bacteria are sitting under your gums, they're eating away at your bone. They're creating toxins.
It's like a gas of some sort?
Yes, and also when you have loose gums, there's food that kind of gets in there that you're not effectively able to clean. You may brush and floss all you want. You may use mouthwash all you want, but that's not addressing the real problem. And when that just sits there and, for lack of a better word, rots, and those bacteria are eating and picking at it, that's what gives you the bad breath.
Okay, now this gum surgery, the traditional gum surgery, and we're not, and like you said, you don't want to say anything negative about that because that also works.
Absolutely.
But there's two ways to do it.
Yes.
Go around the mouth with a laser, kill the bacteria, or cut it out.
Yes.
In a way.
Yes. Would you want healing by amputation or would you want healing by regeneration? I take regeneration or growing new tissue, healthy tissue, anytime over cutting. Because after a certain point, you run out of stuff to cut. So if I can grow new tissue, healthy tissue, stronger tissue, I choose that.
When you say grow, it's kind of like lasers on the face. It rebuilds collagen.
Yes.
Fills in the wrinkles, things like that. Same kind of things going on with the gum line.
Yes, yes.
Really?
It actually stimulates your bone and the cells that form the inside of your gums, like I said, we've gotten rid of the bacteria. And it's just telling that tissue there, you can now heal, you can now grow. And that's what's happening.
So the number one way you lose your teeth is gum disease. Is
Yes,
that true?
yes.
And you say the laser can wipe it out.
It does, yes.
If there's 30 million people, depending on, you Google this, 30 million people that have an upper lower denture, most of those people had gum disease.
Yes.
Do you believe if they were treated early, I'll put you on the spot, and I know this is just your opinion, but treated early, you think you would have wiped out, they wouldn't have been in dentures?
More than likely, yes, more than likely.
More than likely? What do you think? Like if you got them early, you could have saved their teeth?
Yes, yes.
Because nobody wants to lose their teeth.
Nobody wants to lose teeth. We had a gentleman the other day came in with teeth that were loose, and he's crying. He hasn't been able to get in to a dentist, not just me, to any dentist for the last 10 years. He's been helping his wife who had cancer. She passed. He was finally trying to get his life together. He's like, I don't want to lose my teeth. Because he's thinking he's probably going to start dating and he does not want to go out and meet people. He's embarrassed because he has bad breath, his gums bleed, and his way of telling me was that, you look at my gums and they're going to bleed. Well, you know what he's trying to tell you, that they bleed at even the slightest bit.
But a little bit of blood on a floss is okay. A little bit.
No blood is okay.
Really?
No blood is okay. Let me ask you, if you comb your hair, if you run a brush through your hair and your scalp bleeds, would you be okay?
Right, but is that a fair comparison?
It is.
So gums are not supposed to bleed at all?
They are not.
Even flossing?
Not at all.
So you have an infection. That means if you're bleeding...
Yes.
Really?
Yes. You have an infection, it needs to be fixed.
So if you can get people in early, and we've talked about this on other interviews, people put it off and put it off and put it off. So if you just zap the little area with the laser, you kill that infected area.
You do.
And you're good again.
Yes, you're disinfecting the area. You got rid of the bacteria. Your body's going to take over. Our body's amazing. It knows how to heal itself. It just cannot heal when you have a live infection. You get rid of that, your body jumps right in and tries to heal itself. No blood is okay.
Now, we should mention, you're pretty serious about this, and people need to know I'm not siding with you, but you actually look at their bacteria under a microscope live right in front of them.
We do.
Tell me about that.
We do. It's pretty exciting. I'm a geek, what can I say?
Okay.
I love teeth.
All right.
But more than that, I care about my patients. So every patient that comes into the practice, we have a microscope that we take a plaque sample of. Plaque is the bacteria that lives on our teeth, under our gums. And we take a plaque sample, mount it on the slide.
Does that hurt? Or you're just
No, it's
a swab?
what you can, yes, it's a swab. There's nothing painful. And it's the fuzzies on our teeth when we wake up, which we shouldn't have, by the way. And that gets mounted on the microscope, and you see the bacteria. And most people with gum disease have a lot of bacteria. The minute they look at it, they're like, get this out of me. But yes, we all have bacteria in our mouth, good as well as bad.
So you know what the bad ones look like?
Yes, and when you have gum disease, we see more of the bad bugs, more of the spirochetes as we call them. They're the more aggressive bugs that are the true causative factors in all the bone loss and the bleeding gums and the bad breath that we see.
So when they see it and they go, you got to get this out of my mouth.
When can we get this out? Nobody wants that in their mouth. I know I wouldn't.
So this is FDA approved to be effective.
Yes.
Okay. So logically it makes sense. So why aren't all dentists doing it this way? What's your take? In a positive way, I guess. What's your take on this? They don't believe it?
There's a lot that don't believe it. There's a lack of knowledge out there as well. Maybe it's due to taking time away from the practice.
And it's expensive. These machines are like $100,000.
It's a significant investment, yes.
Is your machine paid for by now?
Yes.
Well, that's good. Okay, so that affects your prices. That's good.
Yes.
So this is affordable. Now what about, okay, so there's two ways to get rid of gum disease. The bleeding gums, the bad breath, the loose teeth, is the surgery, and then there's the laser, okay?
Yes.
And they're about the same price.
They are.
And so whether you have dental, like if dental insurance, if it'll cover the other procedure, will it cover this?
Typically.
So what if somebody's scheduled, right? They're watching this, they're scheduled for this gum surgery. Do you say get a second opinion?
Yes. Find out your options. Find what other alternatives there are to be able to treat this. If one works just as well as the other, why would we not want to consider the less uncomfortable option? If you're getting the same results, if you're actually, there's a possibility that we can regenerate new tissue, new bone, new gum tissue, new connective tissue, new attachments. That's what you want. Get a second opinion, absolutely.
Okay, now when I see you have like buttons on the website, or if this says no cutting, or no cut, no sew, what are you referring to there?
That we're not cutting, there's no scalpels involved, no stitches or sutures involved. The laser does all the work. It seeks out the disease. It kills the bacteria. We're trying to create optimal health. We give you the tools to get there.
And how soon does the bad breath go away if everything works out?
It's pretty instant, not just right then, but as your healing occurs, most patients will say, all patients come in and say, I've never felt so clean before. My mouth has never felt so good. They find they're not constantly popping the mouth fresheners or the mouthwash to kind of mask that bad breath. They just notice a fresher breath.
As you say, it can change someone's life.
Yes.
How so?
Very common, very common. We see this so often, and what comes to mind is this one lady who came in, just lack of self-esteem. She always was conscious about her smile, worried about the bad breath, her bleeding gums. She came in, had the procedure done, got healthy to where she's now coming in for veneers, getting her new smile, she's applying for a job, and every time I see her, she's just so upbeat and bubbly. She's literally, her life has taken a turn.
Now, we should mention, because you do a lot of things in your practice. I know you're not a specialist, but you kind of do everything under one roof there. You make your own crowns right there, right? In fact, you've been a dentist since you were about 9 years old. You pulled your first tooth out of a patient at 9 years old.
I did. I was not a dentist at 9.
How are you able to do this?
So I grew up in India, and where we lived, we had a dentist practicing on the first floor, and that was where I spent my summers, hanging out at his practice. And we had this one lady who knew me since I was born, a friend of the family. She came in for a tooth that was flapping in the wind. She could have wiggled it out herself. But they both saw me going, ooh, can I look at it? And, the dentist asked her, do you mind? She said no. And he's like, do you want to pull this tooth? And I about died and went to heaven, right? So, and that's when he held my hand and we held the tooth and we wiggled it out.
Like little pliers, you just pulled it right out?
Yes, not little, they were the real pliers too.
Oh, is that right?
But yes.
And then you were hooked.
I was.
Ever
That's
since.
when I knew what I wanted to do all my life.
Okay, so you're using this laser. You go around the mouth, kill this bacterial infection. The gums get healthy. Now, what about the red, big, puffy gums? Is that also gum disease?
Yes. That's just inflammation. That needs to go. That's what contributes to your bleeding gums as well. That's your swelling. We want your gums to be nice, tight, pink, hugging the teeth. We want tight gum tissue. We don't want any gaps. And that's another thing that I found for when we have patients that are treating their gum disease the traditional way with the cutting. They tend to have long teeth because the gum has been cut away.
Now, a periodontist once told me, he says, because it's a lot of stitches and things like that, that they do one quadrant or one side of the mouth with the old, I guess it's being done this way today. And they can't even get people to come back for the other half of their mouth.
I don't blame them, do you? If it's uncomfortable.
So you hear these stories too?
Yes.
Do patients ever come in and say, I had part surgery, I want to avoid surgery?
They want to come in and see if they can do the LANAP on the other side of the mouth because they did their research, right? They had that, realized that was not a fun thing to have and looked for options and found that this works just as well.
So is this like a movement in dentistry going toward lasers?
Yes.
And this is how people lose their teeth?
Yes.
Which is gum disease.
Yes, and that is the most common cause.
So when you hear dentists
loss.
on TV, and I'm sorry for interrupting you, but like when you hear just, floss and brush and this and that, or you hear, because I hear dentists all the time, they'll say, oh, they just neglected their mouth. But you don't necessarily buy into that. That means they had a bacterial infection that they couldn't stay ahead of.
Right. And it has to be treated like such. If it's an infection, you treat it like an infection. You have to go after the source. Brushing and flossing is not going to get rid of those bacteria that are way below your gums.
So you meet people that are like brushing and flossing,
and they do have
more than people with good teeth.
Yes. Those are the ones that actually care. They want to keep their teeth. They know what this can do. They don't like the bleeding gums. They don't like the bad breath. And they're the ones that'll come in and say, but I floss 5 times a day. Don't get me wrong. We have to floss. But flossing is not going to address this issue, which is where the laser comes in and works fabulously.
Now, after talking to you, I spoke to a hygienist, and they were saying, oh, some patients just, I know they're not brushing and flossing. But you don't necessarily believe that.
Yes.
Because there are people brushing and flossing.
Yes, absolutely. Yes. Like I said, and these are the folks that are doing it multiple times a day because they have the bad breath. And the brushing and flossing is not fixing it. They need help.
Now back to the puffy gums. So if somebody has the big red puffy gums, so underneath there's an infection causing this inflammation. How soon does that go away? And what's your experience with that?
We see results pretty quickly. So with the puffy gums and such, I have a patient that comes to mind who came in with the exact same complaints. We had these red, puffy, bleeding gums. She was just so conscious about it, didn't smile ever because it just bothered her that her gums were like that. She came in for the procedure. We did the procedure. Things were looking good when she left. She was quite comfortable. I followed up with her that night, make sure she was okay. And when she came in for a post-op a few days later, it was like magic. Her gums were looking so much better. Things were healing. The redness was going away quite a bit. It was almost gone. And things were looking so much healthier. It's just amazing how the tissues heal.
Now this could kind of change dentistry as we know it. Is that right?
Yes, yes.
Because everybody, now what about like tartar or gingivitis and all these things? Are these all named for different bacteria in the mouth?
Gingivitis is just an inflammation of your gums. It's the irritation and the redness of your gums at the superficial layer. Tartar is when you have so much build up. Plaque is colonies of bacteria that stick to your teeth. When that doesn't get cleaned away, it calcifies and hardens up into what we know as tartar. It's still bacteria.
But that's all a bacterial infection.
Yes.
Like at the bottom of a boat,
The barnacles.
Like the barnacles.
Yes.
So basically, people are living in a state of going in, cleaning off, and then it just keeps growing back because
Right.
they never take away the source of the bacteria.
That is correct.
Really?
That is correct.
So when the laser, it keeps it from coming back.
That is
How
right.
long can it last?
We have to maintain it, right? People have to keep up with their regular dental visits, keep up with home care, but all that is so much easier now because we've taken away the source of the infection. The most common analogy I use with my patients is, if I have a bee that gets into the house, I can get it out. But if I have a beehive in the attic, no matter how many bees I get rid of, until I get rid of the beehive, it's never truly taken care of. I have to get to the beehive. That's under the gums. That's feeding all of this infection. I have to eliminate that to be able to see the true results, to have patients to where their gums are tight, healthy, and they're able to maintain it there.
And so you're doing this every week in your practice?
All day long, every day.
Is that right? So this is a big, how do people hear about you? Is it the holistic crowd, like the Whole Foods crowd? You know, that
It's everybody, I'll be honest with you. It's not just those that care about their health, it's people that care about not losing their teeth,
Okay.
people that care about their bleeding gums or their bad breath, or I had one lady tell me her gums were floppy, which you think about it, yes, loose gums, right? She actually noticed it to where her gums were floppy. Teeth that are shifting, people that don't want to lose their teeth. And most commonly I find they find us through their friends that have had this procedure. It's like, oh, I had this done and my gums feel so much better, you should go see her. And that I find is the most common.
Now you do dental implant. You replace missing teeth in your practice with dental implants.
We do.
Are you using the laser to disinfect the area with those people?
Yes, this laser will work around implants as well. When we have folks that have failing implants, for whatever reason, they get a bacterial infection around their implants. Guess where that came from? From other teeth that had this issue, and you can't isolate the bacteria. They're going to find other areas that they can pick at in your mouth. And we can go in there and actually help with the infection around those as well.
You have a video, and we're short on time, but there's a video of how it's an animation of how the laser works. So what are we looking at? This is kind of what's going on?
So with the laser, what you're seeing is the first pass with the laser, which is letting us get to the bottoms of the gums inside by the bone. And that just gives us more access to be able to clean away at the tartar that may be sitting there, any bacteria that are sitting there. And like I said earlier, this is targeting the bacteria there. My Star Wars analogy, right? We're imploding those with the laser. We're getting rid of the bacteria. And we go back with the second round of the laser to kind of heal and seal everything. And this just helps promote your tissues to heal the way they need to.
So when people say, I have good teeth, but I have bad gums, is that silly when you hear that in a way?
It's not silly at all. They actually know what they're talking about.
So their teeth are good?
Yes.
It's just the gums.
It is the gums. It's the lack of bone support because that has been eaten away by the bacteria.
Oh, so the bone goes away, and that's why the teeth get loose.
get loose and fall out. Yeah.
So the laser kind of helps stimulate the bone?
It does. It does. And it makes your gums nice and tight around your teeth. It hugs them tighter so everything's more stable.
So people that it hurts when they eat and chew, does that also go away for many of these people?
If it is a gum infection, yes. Yes. We see this all too often every day.
So in your town, serves a big area. So every single day people are going to periodontists. And I'm not trying to be mean to periodontists because a lot of the periodontists are using this laser, the same protocol. But they're scheduled every single day, hundreds of these procedures a month to get the surgical way of cutting it out. Because that's crazy to try to cut out a bacterial infection, or at least to me.
It is, I agree.
Are you ever surprised at the results?
With the Linap, yes. Yes, every single time. Because I know what it can do, but every single patient, it's just a joy to watch the patients come back and to see how wonderful their mouths look, but how amazing they're feeling too. This is a bacterial infection. It's not going to stay isolated to your mouth. Believe it or not, your head is connected to the rest of your body, right? Every time you're chewing, you're pushing those bacteria into your bloodstream.
Oh, so if you have a bleeding gums, that bacteria is going into your bloodstream.
It is. It is.
Oh, interesting.
You're setting up inflammation in your body, what I call as hot spots. That's just areas of inflammation that your body's setting up. Patients with the autoimmune diseases, rheumatoid arthritis. I see low birth weight babies for pregnant moms, early preterm labor, loss of libido in men. There's so many conditions that this all relates to, and we never connect the dots because, oh, it's in my mouth and it's my gum that's bleeding, but it does affect the rest of your body.
And it's transferable? Is that right?
Yes. I always caution parents or moms to, if they're having this procedure, to not share utensils or food.
Don't kiss somebody with bleeding gums. That seems like an easy one.
We'll get them to fix it.
So you ask your date, do you bleed when you floss? And if you do bleed, go see Dr. Dassani.
Absolutely.
Because it does sound easy, I have to tell you. And people need to know I'm not siding with you, but I mean, I'm not an expert at all on this topic. Could an expert say what Dr. Dassani is saying is a bit of an exaggeration?
Well, you know, the key thought leaders in dentistry are endorsing this procedure, and that should tell you a lot.
Even the periodontists?
Even the periodontists, and a lot of them use it too in their own practice. And that tells me a lot as to how effective it is. I see the results all day, every day on patients that we treat, and the proof's right there.
So even if you've been told, I have to extract teeth, see a dentist with a laser.
Get that opinion.
Because
yes.
you might be able to save those teeth.
Yes.
Because it's expensive to lose teeth, as you told me.
Yes. And nothing functions like your natural tooth. If you can save your tooth, that's amazing.
Okay, good. So no more bleeding gums, no more bad breath, no more loose teeth with this laser. Sounds good. In the future, do you think like the hygiene team, maybe at a lower settings, will go around the mouth? I mean, the future of dentistry, everybody will get kind of a laser?
They are doing it today at our office. There is laser disinfection done for patients that need it, bleeding gums. So there's offices doing it every day, and this certainly is the way dentistry is headed.
Now, here in California and across the country, there's a lot of people that say they'll take death before antibiotics. They won't do antibiotics. Could they attempt this with just the laser with no antibiotics?
Yes, because you're getting rid of the bacteria, which is what the antibiotic is wanting to do as well, kill the bacteria. The laser does it for you.
Okay, good. I want to thank you for coming to the show. Very interesting. And this information is on your website. You do the consultations for free.
That is correct.
And how soon, on the consult, how soon before you could tell them, we think you'd be a good candidate?
For a lot of folks, it's just while I'm talking to them. The x-rays show me a lot, depending on bone levels. The minute we stick that slide under the microscope, I know. A lot of these patients that show up for this procedure, no.
Okay.
They'll call and say, I want the Lanap. They're educated. They know what they need. And for those that don't, we're here. We're able to tell you what you need.
Great stuff. I want to thank you for coming on the program.
Thank you.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.